NLP Health and Wellbeing, read by the authors, Joseph O'Connor
and Ian McDermott.
Health and Wellbeing. Small words for a huge subject. Not just an interesting one, but one we live and breathe every day. They're real right now. They're very important. Health is not just a concept, it's an experience. How do you experience your health and well-being? Is health feeling good, or is it not feeling bad? It's very tempting to define health as the opposite to illness. But is being healthy the same as not being ill? We don't think so. Health is much more. In our society, health is linked to medicine, and medicine means curing illness. Unfortunately, the Department of Health could be renamed as the Department of Illness, because that's what it deals with most of the time. Usually, we don't pay much attention to health and the accompanying feeling of well-being. They're like many of the good things of life. You only appreciate just how good they were when you lose them. You notice when they go, not when they're there. Then you wish you'd appreciated them more when you had them. Health isn't a thing that can be owned either, even though we talk about it in that way when we say, I have good health. But really, health's an experience that comes from the way our body and mind work together. Health isn't an all-or-nothing measure, something you have or haven't got. Our experience of health and well-being shifts and changes with the weather, with the state of our stomach, and the amount in our bank balance. Some days we feel great. Other days, just so-so, even though we may not be ill. About 400 years before Christ, the Greek physician Hippocrates, regarded as the father of Western medicine, taught that being healthy was evidence that a person had achieved harmony within themselves and with their environment. Now, 2,500 years later, medical science is starting to agree with his view. Another example of historical figures stealing all our best ideas. Contemporary definitions of health come very close to Hippocrates. The World Health Organization defines health as the achievement of physical, psychological, and social well-being. There are three aspects in this definition. First, the physical, which is the one we notice the most. Then, the social. Health is about good and fulfilling relationships. And the third is the psychological. How healthy are your habitual thoughts and feelings? When you're physically healthy, you feel more positive, you think more clearly and creatively, you're more productive. When you get on well with people, you feel happier and you're likely to be healthier. All the three dimensions of health, the physical, the social, and the psychological, work together. They all influence each other. Medical science is just emerging from a period when it treated body and mind as separate things. We know now that they're so intimately connected that really they're different aspects of one person. You can't pull them apart. Two words, body and mind, making one person. The body isn't a machine with some little intelligent mannequin sitting in the brain pulling the levers. That's a ridiculous image, and yet sometimes we think like that. That's the image that comes to my mind when I hear someone say, "Pull yourself together." What am I supposed to be pulling? And who's doing the pulling?
You don't need to go to medical libraries for examples of how mind and body work together. Look at your everyday experience. Look at the instructions on medicine bottles telling you that the pills may cause drowsiness and you shouldn't drive or work with machinery. Illness affects how we think. Pain stops us thinking clearly. We don't make important decisions under the influence of drugs or medicine if we've got any sense. And we know that decisions made in the pub under the influence of alcohol don't always look such a great idea the next morning. We also know the glow of well-being that comes from enjoyable physical exercise. The shivers down your spine when someone says they love you. And then that expansive feeling after a good meal. Thoughts
Sample complete. Ready to continue?